Good afternoon, everyone, and welcome to United Way for Southeastern Michigan's virtual town hall on childcare. My name is Audrey Walker, and I will be your moderator for today's town hall. Today, we will hear from United Way's President and CEO, Dr. Darian Hudson, and two of our very own early childhood team members, Michelle Lee and Elena Onek. For those watching live, please leave your questions in the Q&A chat box, which you will find by clicking the question mark in the top right-hand corner of your screen. The last 10 minutes of today's town hall are reserved for questions, and we will do our best to get through every question. Now I would like to give a warm welcome to United Way for Southeastern Michigan's President and CEO, Dr. Darian Hudson, to say a few words.
Hello, everyone, and welcome to United Way's virtual town hall on childcare. This is just one installment of a series of virtual town halls that we're providing to connect you with the information and resources you need to weather this crisis. To see our previous town halls on unemployment insurance, water and utility assistance, and much, much more, please visit unitedwaysem.org/virtual-town-halls. The website is also included in the Q&A chat box. Before we begin today's program, I would just like to take a moment to reflect and reserve a moment of silence in the memory of George Floyd and countless others who have been brutally killed over the last months, what feels like a very long time before that. And just offer some words of encouragement as we all continue to bond together and hopefully emerge from both of the crises that we are experiencing better together. Thank you. We know that this is an uncertain time for the whole family. Whether you are an essential worker whose child has been in care throughout this pandemic, or if you're planning on returning to work and are unsure of the current state of childcare in your community. Our goal today is to provide you with information that you need to know and recommendations that we have moving forward. Our Great Start to Quality team works with childcare providers to help them increase their star rating, which showcases all of the best practices they do above and beyond what is required by state licensing. During the COVID-19 pandemic, they have stepped up to help essential workers locate childcare when many providers were closed. And access to safe and high quality childcare is important under any circumstance. And today we're here to connect you with the information and the resources that you are going to need to be able to provide the best possible care for your children. Our first speaker today is our very own Michelle Lee, who has been a quality improvement specialist with United Way since 2018. She began her career in education as a middle school teacher and was the lead for her school's after-school latchkey program. Michelle helped found and direct an infant and toddler program, and her passion for early childhood education has fueled her desire to work with United Way and the Great Start to Quality program, where she has assisted providers in Wayne, Oakland, and Macomb counties. Next, we will hear from another one of our United Way All-Stars, Elena Onek, our Great Start to Quality manager. Elena has been with United Way now for 5 years. She began her work in early childhood 20 years ago, teaching Head Start in Metro Detroit, where she learned the value of social emotional learning starting at an early age. Her passion for building children's mental health led her to pursue a bachelor's degree from the University of Michigan Dearborn and a master's degree in educational leadership from Concordia University, Portland. So at this time, I'm very pleased to welcome up Michelle Lee, our quality improvement specialist, who is going to get our program started. Thank you so much. And welcome, Michelle.
Thank you so much, Dr. Hudson. I'm so excited to be here today. In today's session, we'll be giving you an overview of what childcare might look like as it has been greatly impacted by the coronavirus pandemic. We will address what childcares that are currently open are doing and what others are doing to help plan and prepare for their reopening. We will give a glimpse of what may look different, both from the perspective of the childcare provider and what you as a parent can expect to help your child return. We will touch on some questions that can be asked as you plan to bring your child back, and also how to find high quality childcare during COVID-19 and as operations continue to return to normal in the state of Michigan. But mostly, we will be available to answer your questions as you weigh this critical decision of when is the right time for my family to return to childcare. Being a parent and choosing childcare before coronavirus could be a nerve-wracking experience. And as a parent myself, I know that my mind is running a million miles a minute with so many questions and concerns about what this new normal will be as this pandemic continues to evolve. Let me first put your minds at ease and say that childcare providers have been pondering and planning for what reopening will look like since the day the governor issued the first stay-at-home order. Health and safety of staff and children has always been a priority for providers. With the spread of COVID-19, health and safety has become even more of a priority, and new health and safety protocols are now required. The decision to reopen was not and is not one taken lightly by providers. The consideration and planning that directors and owners have been doing is immeasurable. And there have been tools developed by national and local experts that help a provider know if the site is ready to open. One of these tools was developed by the CDC and is a flowchart that helps a provider determine if they are ready to open or not by walking them through a series of questions and then giving a red light or a green light based on the answers. We will have the link to this document in the chat, so if you want to check it out and see what resources are being used by providers, you'll have the opportunity to do so. Childcare centers and homes in the state all received a 14-page document titled Guidelines for Safe Childcare Operations During COVID-19. The Michigan Department of License and Regulatory Affairs, or LARA as it's referred to, has developed this guidance in consultation with the Michigan Departments of Education, Health and Human Services, and Labor and Economic Opportunity, the Executive Office, medical professionals, national experts, and childcare providers across the state. So you can see that the providers are not making this decision in a vacuum independently, and there are many experts helping them weigh in. All licensed childcare sites, like all Michigan employers, must develop and implement a COVID-19 preparedness and response plan. This plan is made available for staff and families to review. So now let's take a look at the points addressed in these plans. These plans will talk about how providers will monitor symptoms of COVID-19, how programs practice social distancing as developmentally appropriate, since we know that based on the age of your child, school age, preschool, toddler, they're going to have a different understanding and capability to manage social distancing. How providers will ensure hygiene, including regular cleaning and disinfecting of objects, toys, high-touch surface areas throughout the home or center. How providers will use safety equipment, including PPE and other masks when appropriate, and what communication for protocol for families will look like to report symptoms of a positive test, and policies of when your child will have to be excluded from care. Staff will also be more vigilant about staying home when not feeling well. We all know as adults, we sometimes try to work through it when we aren't feeling well and carry a sort of guilt about leaving our coworkers high and dry. As a part of their plan, directors and owners need to have a backup plan for coverage when staff becomes ill to make sure that ratios are kept and that caregivers know it's okay to stay home. As a result of these preparedness and response plans, there may be significant changes to policies and procedures that parents are responsible for knowing and agreeing to. In fact, your provider may have already sent home revised handbooks or have a COVID-19 policy for you to review. Some of these changes may have financial implications, so don't hesitate to ask questions like, what does the tuition policy look like? And am I responsible for tuition if my child does not attend? Or am I still responsible for the full tuition if my child is sent home sick? It is very important to thoroughly read through any new policies put in place by your childcare provider and understand what you're agreeing to. As a former director, I cannot stress this enough. When you sign that policy or handbook acknowledgement form, you're agreeing to and will be held responsible for everything in the document, even if you may not have had time to read it all the way through or understand all the details. So don't be afraid to ask questions or clarify anything you're unsure of with your provider. They're there to help. If you're seeking childcare at a new location, we have a handy guide with questions to ask and a checklist to use as you interview providers. A link to this document will also be in the chat, so you will have access to it from here forward. Internally, things will look different for staff as well. Daily temperature checks upon arrival will become new routine and also throughout the day. New policies for staff also include the wearing of masks or face coverings during the workday, as well as an increase in hand washing. Just be assured your childcare providers want you to ask questions. They want to know what's on your mind, what concerns you might have, and to make sure you feel comfortable and confident having your child in their care. If there's something that you're unsure of, make sure to ask and have your questions clearly answered before moving on. Again, establish that partnership between yourself and the provider, and this will help make the transition back into care smooth for all parties involved. Now I will turn it over to Elena, and she is going to give you a glimpse of what this might look like from the family perspective as you return to childcare.
Thank you, Michelle. As Michelle had mentioned, all licensed providers will be creating a COVID preparedness and response plan, and I'm going to leave enough time for questions and answers. So I'm just real quick going to let you guys know, the plan will be available to you, and this will help you know what to expect when your child returns. And even if your child's excited to return, I really want to encourage you to prepare your child in advance for the changes they may notice in their daily routine and environment. This will not only help you be prepared and feel in control, and your child feel in control, and make that transition back smooth for you and your child's caregiver. One major change will be the COVID-19 symptom checks before they enter the classroom, and this will include a temperature check if and whether or not your child has been in contact with a person who has had COVID-19, they'll be asking you that, and if your child has felt unwell in the last 3 days. So that will be one of the major changes. Please keep in mind that providers will be doing a recheck throughout the day, so if the child appears sick or displays symptoms for COVID-19, they may give you a call, so have a Plan B ready to roll, because if they do, they will be excluded from the program. Also, to alleviate a little bit of additional stress from this pickup and drop off time that will be a little bit different, please allow for a little bit of extra time. This will just, help you and your provider. I know the classroom teachers would appreciate, having that time. As a former teacher, some things in the classroom that will look a little bit different. Classroom furniture may be rearranged to eliminate common space or allow fewer children in an interest area. So there may be more teacher-directed activities rather than child-initiated, which we know are best practices in the early learning environment. Also rearrange seating to allow children to sit 6 feet apart when possible, especially during meal times. So unfortunately, we may see less family style meals where children can serve themselves and eat together. Outside activities will be more guided social distancing play rather than outdoor structures. They'll be playing more games like follow the leader, obstacle courses, and neighborhood walks, and removal of objects and toys that cannot be easily cleaned or sanitized. As mentioned, face masks should be worn. We have heard concerns over providers having covered face, especially keeping in mind those little ones that may be new to a program or have special needs, because children can be uncertain when they cannot see someone's face who is approaching them, or facial expressions. So it was decided that facilities will establish their own policies for staff and children for when they should be worn. And for children, this will depend on their age and the number of children in care, and whether a child can remove that mask without assistance. And the American Pediatric or Academy of Pediatrics provides tips for how to become more comfortable with wearing face coverings for children, and we're putting that in the links. And of course, as we've all been washing our hands more to help eliminate the spread of the illness, we will continue in childcare and preschool programs to be going by the CDC guidelines of doing so. And I think we now have some time for questions and answers.
Yes, we do. Thank you so much, Elena and Michelle, for your great tips. And we do have some questions coming in. If you've not yet done so, please put your questions in the Q&A chat box. Now, our first question is for you, Michelle. You said that providers have to have a COVID plan. So how would I know if they have one that works? And what specific questions should I be asking in regards to that?
It's a great question, Audrey. So the COVID response plan is a plan that is available for parents to view. I would recommend making contact with your provider and having a few questions handy of things that really are a concern with you. I know having a young infant, 1-year-old in my house, one of my questions would be, how do you do hand washing for infants and how can I practice this at home? Also, talking about social distancing. I know there's multiple caregivers in the classroom, so maybe asking your provider how that's going to look like and how the caregivers are going to ensure distances. And then again, just making sure that you're familiar with that policy of if the illness is reported, how it will be reported to your family, what will happen in case of a closure. So definitely contacting your provider and having that open dialogue is highly recommended. Great.
That is definitely good advice on that. Elena, we have a question here for you. Is my child going to be able to bring things from home? And also, you know, this could apply to infants about sharing toys, or if infants or children are putting toys in their mouths, like what is the recommendation or what should people be looking for as far as guidelines along that?
Thank you for the question. Bringing things from home may be a little bit different, especially like car seats are probably going to be asked to be left outside just to prevent the spread of outside germs. You may be asked to bring like an extra pair of slippers or shoes, and also like those comfort items, as you mentioned, like blankets and toys will probably be asked to be in the cubbies throughout the day until like nap time. And instead of being brought home like weekly to be washed, maybe daily. And we can also put a link in the chat box on how to like sanitize and wash those soft items too. But like we said, every center will have their own policies. So make sure that you check those out and ask about it.
Great. And you had also mentioned, Elena, getting your child prepared to expect some changes. But what about how we can help our kids transition back to care if they've been used to being at home all day or at home with their parents? What are some recommendations you have on that?
Oh, great question. So it's just like, you know, when your child will be transitioning to like a kindergarten program, or if they were in elementary school, that time off can be rough. It throws a routine off. You know, just kind of try to get them used to the daily routine again of having a nap time at a certain time and getting up at a certain time, just to prepare them for that, since they've maybe have been sleeping in for a little bit, or nap can be pushed back or, you know, moved while at home.
Okay. So similar to if you're getting your child ready to experience daycare maybe for the first time, and getting ready for being somewhere else other than at your house too.
Yes.
And I know we've been talking a lot about what the children will experience and what the providers are doing, but what about, the parent experience? Are parents going to be allowed to go into the child's classroom, and what is that going to look like for the parents or whoever's doing drop off or pickup? Michelle, if you want to take that one.
Certainly. As I said, as a former director, we used to have an open door policy and parents were welcome into the classroom at any time. A lot of the dialogue and conversation happened first thing in the morning at drop off or in the afternoon at pickup. So we know from talking with providers that that is going to look a little different. Kind of create and have a plan with your childcare provider. If as being the mother, you're the one who wants to get the information, find out if there's ways, if your classroom teacher is open to texting or daily notes, if your center or home has such, trying to think what the wording for, is it Bright Wheel or any other type of app where you can have that communication. Some of those apps allow providers to put pictures in during the day and give updates kind of in real time. So again, we just encourage that open dialogue, and you may not be able to physically be there in the classroom with your child like you were before, but there are definitely, as we've all learned, so many more virtual platforms that allow this.
And as far as a lot of the information, you had mentioned the 14-page document that providers got and things like that. Are there, generic waivers that providers add to parent contracts or anything like that additionally that people should expect when they're going to a center or a home?
I can go back to this one.
Yes, thank you.
Yes, each center does have their own handbook acknowledgement form and policies and procedures. A lot of these are standard pre-COVID, which would include, especially coming into summer, sunscreen application forms, if there's any type of medication that needs to be administered. And then we've, kind of heard of some new acknowledgement forms. Parents may be asked to report to their provider if they are traveling out of state or if they've had outside visitors in their home. Not exactly saying to exclude them, but just to be aware of, kind of what environments the children are in. So each program can vary, but aside from the standard documents, parents may definitely see some new documentation and policies out there.
Okay. And we've got another question here. Elena, I'm going to direct this one to you. What if my provider doesn't plan to reopen or doesn't have space because of social distancing, or even maybe speaking to the classroom size, the child, will the child have the same teacher and those types of things? Can you give us some insight on that, please?
Yes. Currently, we have, we're working with our partners at Help Me Grow. So you could go to helpmegrow.com to see if, and just fill out a short survey of what your needs are, and we can connect you then with childcare in your area or the area of where you work. And you can always search the state licensed programs through Great Start to Quality on greatstarttoquality.com. The quality rating system makes it easy for programs to, or for parents to find what programs have high quality experiences for children, and also offers a lot of tips to make informed decisions on, what program would best suit your child and your family's needs.
Great. And should parents expect changes in the classroom as far as how many children might be in there, or, if their child had the same teacher, would they be then able to have the same teacher, be with some of their friends and things like that?
So it is recommended that classroom sizes stay under 10 and that children are in close to the same age group together. So we, not mixing infants that cannot have like the influenza vaccination with, children that are older. So it might be a good question if your child has like a really close friend in their class, because classrooms may be look a little different, or they may split them up differently if your child can be in the same class as their friend.
Okay. we are getting a lot of questions about mask wearing. And I know you addressed it for the providers, but a lot of questions about mask wearing for children, especially those that are 3 and 4 years old. Can you shed a little light on what that might look like at a center at the home? Elena, if you want to chime in, and then Michelle, obviously, if you want to chime in too, please feel free to do so.
So, as I said, that's going to be a policy that is up to providers. It's going to also depend on how many children are in their care and whether or not the child can safely take the mask off themselves. So that's really, that's up to the provider. Do you have anything that you've heard, Michelle?
Yes, I do have. From talking with other providers, some is based on parent preference. So if there is, parental preference that your child wear a mask, that can be communicated to the provider. But I believe overall, again, like Elena said, it's dependent on the program, the class size, and then the age of the children. But I can encourage you, if you have not, to practice at home wearing a mask with your child. I discovered taking my 1-year-old to the pediatrician that she thought it was hilarious having a mask across mom's face and kept grabbing and trying to pull it down. So if your child hasn't been exposed to you wearing a mask, it's a great opportunity to practice at home before going out into the center where they may be required to wear one or have their caregivers wearing them.
Great. And, we've been talking a lot about daycare centers and home daycares. Do the same rules and regulations apply to summer camp programs or community summer programs and things like that children go to in summertime? Michelle?
Yes, I can take this one. So licensing, Lara does put out separate licensing rule books for a program, whether it's a home-based or a center-based. At this time, in terms of the COVID-specific documents, there was one guidance given to homes and providers totally. And if providers have questions about this, we always recommend to reach out to your licensing consultant in your area. They will have what specific guidelines and things they're looking for with your program. And summer camps, kind of the same protocol as the others. I hope that was helpful.
Yeah, definitely helpful. A lot of great information that both of you are sharing. We've got a lot of great information in the Q&A chat box with all the links that were provided. And we just want to say thank you to everybody who has participated today with the questions. And thank you to both you, Michelle and Elena, for joining us. And now I'm going to turn it back over to Dr. Hudson.
Yeah. Okay. Thank you so much, Audrey, and a very special thank you to Michelle and Elena for this really helpful information. As you can see, there are lots of questions that are coming, and so we encourage you, please, to continue to come back to the website to check out the virtual halls. We will make sure that all of these questions, the answers to all of those questions are available to you. Wanted to also just share, if anyone listening is experiencing any difficulties right now, our 211 hotline is still open and available to help you. It is a 24/7 service, so you can call us literally 24 hours a day, 7 days a week. We will be here to support you. We maintain a running list of available resources and agencies that are here to help connect you to the resources that you need. This includes food pantries. This includes diapers, utility assistance, anything that you can think of. If you call 211, we'll be able to provide those resources for you. You can also look up resources in your area by going to our United Way website at unitedwaysem.org/211. And on the search page, you can enter the resource that you're looking for. All you need is your zip code, and you'll still be able to find the list of available resources to you. So I hope that you enjoyed today, and we look forward to you being back next week for another important topic. Our next town hall is focused on the 2020 census. It will be next Wednesday, June 10th at 10 a.m. We are very pleased to have with us Carrie Ebersol, who is the director for the Michigan statewide census. And so until then, we ask that you all continue to stay safe and to stay healthy and to live united. Thank you for joining us today.